Diet Survey. Over 3 billion people cannot afford a healthy diet, with serious consequences for health and development. To achieve a world without hunger and malnutrition, we need to rethink how we grow, eat, and share our food. Information on what and how much people eat and drink is essential. Where can we find this information? The dietary surveys tells us about the energy and the nutrient that people get from the food they eat. According to the WHO, the term dietary surveys refers to a group of methods that are used to collect the food consumption data to study the diets of individuals or groups. Coming on to the methods of dietary surveys, there are 5 different methods of dietary survey. First one is the food balance sheet method. This method of dietary survey is used to evaluate the trend in the food consumption for a large populations and groups. The food balance sheet shows a brief picture of the pattern of the food supply for a country. For each food item, it sketches the primary commodity available for the human consumption, that is, the source of the supply and its utilization in terms of the nutrient value. Following are the uses and limitations for the food balance sheet method. The second method is the Weighment method. It is one of the most accurate methods for obtaining the dietary intake data of the individuals. In this case, all the foods, that is the liquids and the solids consumed by an individual, is carefully weighed prior to the ingestion. Also, a record of waste plate, that is the amount of food not catched by the subject, is kept. Then, through a simple calculations, the dietary intake of the individuals is worked out. Following are the uses and limitations of the Weighment method. The next method is the food record or the food diary method. In this method, the subject has to keep a written record of all the foods and the beverages ingested over a given period of time, after which the portion sizes are estimated using the food models and standard measuring instruments, or the food items are actually weighed as shown in the above picture. Following are the uses and limitations of the food record or the food diary method. The next method is the 24-hour recall method. This method is said to be used in large-scale nutrition surveys to collect the dietary intake data of individuals. In this method, the subject is asked to recall in as much as details for food intake for past 24 hours by interviews or by the questionnaire method. The interview is conducted by the trained personnel using food models as well as the standard measuring instruments. Following are the uses and limitations for 24-hour recall method. Last method is the food frequency method. This method of diet survey consists of asking the individuals by interview or by a checklist how often, that is daily, weekly or monthly, the specific foods are eaten. Usually, the foods are grouped into categories based on their functions and nutritive value, and then the frequency with which the food groups are consumed is recorded, which is used as the index of the diet pattern. Following are the uses and limitations for the food frequency method. Results of diet survey. As we all know that the COVID-19 pandemic threw the fresh challenges at overcoming the global nutrition crisis and highlighted the impact of sustainable eating to combat the malnutrition, hidden hunger, and diet-related non-communicable diseases. The number of deaths attributed to poor diet has risen by 15% since 2010 and is responsible for more than 12 million non-communicable deaths in adults. According to the survey conducted by the National Family Health Survey, anemia among the children has become significantly worse, with the current prevalence of 67% compared to 58.6%, which was the result of the earlier survey. The overweight or obesity is also found to rise among the Indian adult males and females. The National Family Health Survey recorded 24% adult women to be overweight or obese, and 22.9% adult men were also found to be overweight in the survey. according to the reports of the Global Nutrition Survey, also states that the India is eating a poor diet. Also, the report suggested that the 70% of the Indians prioritize their dietary changes over going to the gym. With all these going around the country, the question arises is where are we lacking? Although the India has become a self-sufficient in grain production and has enjoyed a steady economic growth, despite all this, there is no significant alleviation of poverty, food insecurity, and malnutrition in the country. In terms of public health and nutrition, reasons such as the growing prevalence of food insecurity, false supply of the public distribution system, more undernourished people, less sufficiency of the food in household, lack of money and education might be few of the biggest obstacles. According to the WHO, the gaps and the roads to recovery can be filled by 2025 and the global nutrition target can be achieved by following the listed protocols. Thank you for watching.